Hi, my name is Amanda Kornberg, and this is my presentation on homeless adults. This is the vulnerable population that I chose to focus on throughout this class, and this is my presentation on the health concerns associated with this population group. They are very vulnerable. Um, this homeless population ages 18 to 64 years of age. They have no permanent home. They lack a safe, stable, or appropriate place to live. They may live in sheltered areas or unsheltered areas. Sheltered meaning they're in on the road home, or they have a temporary sheltered place. Unsheltered, they're out on the streets or in the mountains in makeshift tents or blankets or whatever it may be. Sometimes homeless people are doubled up or in overcrowded situations with family, friends, or motels that don't have adequate facilities for them. I already said living in tents or the temporary enclosures. Basically, they just have no place to call home permanently and don't know where they are going from night to night. Locally, these are our numbers. I live in Mapleton, Utah, and so my local community, uh, there's not really numbers as in the cities, but counties, these are the numbers. Utah County has 146, and compared to Summit and Wasatch County, we look pretty high. But compared to last year, we are down a little bit in our numbers. PIT stands for Point in Time Summary. I don't know if they just choose a day. They didn't really describe how they get these numbers, but it is just kind of a point in time. They try and calculate how many people they can find that are homeless, either sheltered or unsheltered. And this is a head count of total persons for the state. We have 2,798 as of last year. And then it kind of, just for your information, kind of divides it into these categories. Everything below households would be in our group that ages 18 to 64. Nationally, how do we compare? Sorry, my record button is right by the next button. So nationally, how we compare nationally, our surrounding states, we have greater numbers than Wyoming and Idaho, but less numbers than Colorado, New Mexico, Arizona, and Nevada. And then FYI, California and LA are the largest population for homeless individuals. Internationally, this is how the US compares. We're not as great as New Zealand. And interestingly, the numbers in red, the countries in red don't have like an official strategy on homelessness, but the ones in blue do. And so this is kind of an interesting comparison across the countries. And here is the US. So worldwide, there's about 2% of the world's population that are homeless, but 1.6 billion, more than 20% of the world's population, they lack adequate housing. And those are numbers as of 2017. So how do we compare? Utah County, this was just interesting comparison here. We have 146 in Utah County. Salt Lake County contributes the highest out of all the counties, and then statewide, and then our national numbers. We are up from 2018, but we're trending down from 2007, and it will be interesting to see what COVID-19 does to these numbers. Social determinants of health, I think with joblessness and all of these high factors of high cost of housing in Utah, homelessness is a big concern for Utah. And these are all social determinants of health, and they all, in some form or another, the homeless have problems with all of these things: availability to resources, education, job opportunities, access to health care, quality of education, availability to community and support bases. Even though there are support systems out there, oftentimes they just don't utilize those or feel uncomfortable or embarrassed to seek out those opportunities. Transportation options. They often don't have a car. They walk everywhere they go and have to carry all their belongings with them. Language and literacy is a problem as well. And then residential segregation, obviously they're going to go places where they'll be more accepted, but oftentimes those places are not the greatest conditions for them. More poverty level areas, places where there's more trash, lack of cooperation from the communities. And then these social norms and attitudes, we shun the homeless, and they steer clear of us sometimes as well too, and they have kind of a distrust of the government, and it just goes on and on. Contributing factors specifically, these households are female-headed households. They have that lack of support from a male or a partner or two parents are contributing to the income. They oftentimes don't even have education higher than high school or that of high school equivalent. And then mental health is a big problem among this population. IGP stands for intergenerational poverty. Obviously, this goes from one generation to another in this population, and the cycle kind of continues. So why are people homeless? You could answer different questions to these why. The root causes, there are several. There's not just one answer as to why somebody becomes homeless. There's several reasons, and it's different for every individual. This is just one scenario. You have a homeless man. Well, why is he homeless? Because he lost his apartment. Why did he lose his apartment? Because he lost his job. Why did he lose his job? Because he has poor habits that affect his performance at the job and can't do what he's supposed to do. Why? Because he has a mental illness and he deals with it using smoking, drugs, or alcohol. Why does he do that? Well, because he never received a higher education. Why didn't he receive a higher education? Because he had to get a job when he was young to support his mother. Sorry, excuse me. And why did he have to do that? Because his mother had a mental illness and couldn't hold down a job. So root causes are going to be different for each individual, but in kind of a group perspective, your primary causes are education, housing, just having lack of that basic support, and basic healthcare access, because mental illness is a big problem in this population. So when we move on to Maslow's hierarchy of needs, none of these needs are met, and all of them are unmet. If you go just down here to just basic needs in the homeless population, none of these needs are met, and if they are, they're very few, and the conditions are very poor. They don't have adequate toileting. They get their water from different sources. They lack safety. You can imagine sleeping on the streets or on a park bench is just not safe. Or out in the mountains, the foothills, where there's all kinds of things that can get to you. A lot of these people have bug bites that become severe just because they are out in nature. They lack family support, and oftentimes they're trying to get away from family, maybe abusive situations, self-esteem, lots and lots of hopelessness. They just are very hopeless. Self-actualization, sometimes they accept the condition that they're in, but it's not a condition that they want and not one that they saw for themselves. So their anticipated function level is low. How could any of us function if we didn't have our basic needs met? Unlike the outcomes, they deter from basic healthcare needs. They go without checkups. They go without immunizations. They just go without. And they make do. They disregard small aches and pains. Like I said, bug bites, warning signs, just small signals or injuries. They go without or don't take care of just because it's minor, and they don't want to go see people or be scrutinized by those in the community or clinics. So they end up in the ER and the ICUs 4 times more than the general population, and we'll talk about that here. So specific concerns according to communicable diseases, very, very high in this aspect. As you can imagine, just having a lack of basic adequate things that we are used to day in and day out, having a home and a place to lay your head every night. Just have a hard time maintaining personal hygiene. They can't shower every day. maintaining adequate nutrition. A lot of times the nutrition is coming from fast food places and they just don't have good access to good nutrition. Staying in crowded or poorly ventilated environments. Yes, and this is a big thing with COVID-19. Obviously, they don't want us to be around a bunch of people, but when you're homeless, sometimes you don't have a choice. And then trying to do things for work and engaging in sex work, they get STDs. And using IV drugs, this has to do a lot with not having coping mechanisms, and the environments that they're in tends to lead to IV drug use. And then transitioning between imprisonment and homelessment, this is just back to back. They go to prison because they've committed a crime when they were homeless, and then they go to prison, and then they come out, go to a halfway home, and then they become homeless again. And it's just kind of a constant cycle. All this leads to decreased immune systems. High diseases in this population are hepatitis, tuberculosis, HIV, AIDS, STDs, and today even COVID-19. Non-communicable diseases are high in this population as well. Lots of heart disease and cancer, diabetes, and mental illness. These are things that can be treated, but go long-term, they end up dying at higher rates and have higher mortality rates than the general population because they just don't get these early things taken care of when they can be taken care of and let it go too long. But there are things that are available that can help. There's free clinics, there's mobile clinics. 4th Street Clinic I highlighted here just because they do a lot. A lot of times these mobile clinics come to them because these homeless people, they just don't want to leave. They live very isolated lives. They don't want to get out. They don't want to come to a clinic, and they're very fearful of doing that. And so I watched a documentary on this man as a doctor, and this is a PA, and they come out and they treat homeless people all over Utah, specifically in Salt Lake City. The average life expectancy is only 66 years old, and this is according to a U.S. Study, and it's 2 years less than the general population. You or I, who live in a home with a stable environment. The health conditions, even in like those that are housed or like in a shelter versus unshelter, is different. Those that live in, I read one study, those that live in sheltered communities are even better off than those that live just out on the streets. The instability of housed adults over the age of 50, they use the emergency room 4 times more than the general population, and they die of chronic diseases 10% more than the general population. So we obviously have these things available: the Road Home, the 4th Street Clinic. We have all of these government and state programs to help with the homeless. Utah has put millions of dollars in the last few years into improving the homeless situation, but it's still such a concern. These people have a lot of pride, and they have a lot of fear, and trust goes both ways. We need to be more educated. We need to know resources so that we can help these people know what they can do and make them feel more at ease about coming into the community and seeking these things that we have available for them, because some of them it's just out of their control. And that is my presentation. This is a very vulnerable population, and I'm excited, and I've learned a lot about them, and I'm grateful for the things that I've learned, and hope that I can help in the future when they come into the hospital. Thanks.